No two things are exactly the same. A famous quote that can be used to metaphorically describe any two things. Inside a classroom, this quote can be used to describe an entire class. No two children are exactly the same at anything, whether it's reading, recess, or even their behavior. Often in the classroom, you may find students acting out while the rest of their peers are behaving. An outsider looking in may just assume that this student just wants attention, maybe even a spotlight from their peers. Nevertheless, this child may be suffering from a disease called conduct disorder. Conduct disorder is a disorder in which behavior problems are involved, such as drug use, defiant behavior, criminal activity, etc. As an educator, it is important to be aware of this disease for instructional purposes. It is also important to be conscious of the demographics, causes, and symptoms as well. Conduct disorder is a behavioral disorder of childhood and adolescence. Children with conduct disorder are inappropriately acting, violate the behavior expectations of others, and threaten the lives and safety of others. Children with this disorder are often viewed by individuals as usually delinquent children because their behavior is not acceptable to society. Conduct disorder is usually associated with other diseases such as ADHD, anxiety, and substance abuse. Finding ways to handle their anger without physically hurting someone is difficult for these children. Therefore, aggressiveness is very common. Conduct disorder appears in children below the age of 18. However, the rates of conduct disorder in boys is much higher than girls. 16% of boys usually are affected with conduct disorder under the age of 18, and 9% of girls are affected with conduct disorder below the age of 18. However, conduct disorder does increase with age. Most people who have not established conduct disorder already by the age of 8 usually develop it by the age of 12. Up to 40% of the children with conduct disorder grow into adults with antisocial personality disorders. With this information, an educator can better prepare his or herself for their class. Perhaps initially a first grader who a teacher thought that needed to devote more time to social activities with girls needs to actually associate more time with their male students. This can also assist an educator in other ways, such as being able to prevent bullying amongst peers, separating children from recess activities accordingly, and increasing the family bond amongst the children in the classroom as well. Unlike diseases that develop from conduct disorder is usually caused by family issues or brain defects. There are two subtypes of conduct disorders, one beginning in childhood and the other beginning in adolescence. From numerous amounts of research conducted, scientists conclude that conduct disorder stems from poor parent-child relationships, dysfunctional families, inconsistent or inappropriate parenting habits, substance abuse, poor relationship with other children, cognitive problem leading to school failures, or brain damage. Now, a child who is having difficulty in school can lead to the development of a child conduct disorder. The frustration and lack of self-esteem can lead to the development of conduct disorder. Family life is the major cause of conduct disorder, however. First, a history of diseases in the family such as conduct disorder, ADHD, or ADD can be grounds for a child to develop conduct disorder. Second, any type of abuse, whether it's verbal or physical, can also be grounds for conduct disorder. Abuse is hard for anyone of any age group to cope with. Therefore, the amount of stress on a child or adolescent at school or among their peers can also be stressful when dealing with abuse as well as that. Therefore, they develop conduct disorder. Aggression, frustration, and low self-esteem are the foundations for the development of conduct disorder. Conduct disorder does not directly affect the brain. However, the diseases that stem from conduct disorders such as ADHD do. The brain is affected later development because a normal brain has larger temporal lobes than the ADHD brain that later develops from cognitive disorder. Therefore, it may be hard for a student to retain information versus a student who does not have any type of brain disorder at all. Now, when dealing with a way to cure cognitive disorder or tame it, it's maybe very difficult because doctors may present the parent of the individual with different forms of medication or several other ways to help this child, and the number one will be medication. Although it seems that medication may be the easiest and quickest way out, it really should be the last option because the use of medication can and will cause the child to be dependent on the medication. Therefore, if doctors or the parents eventually try to wean the children off of the medication, it will be a very difficult task because they're so used to taking it. So instead of, running to medication for the first option, all the other options should be tried first, and then if nothing else can be done, that's when medication should be called for. Cognitive disorder has many symptoms. However, inside a classroom setting, the teacher needs to be very careful when recommending someone for evaluation. Reason being is that since the age group in which cognitive disorder develops in children, it is also the age group in which children like to be the center of attention amongst their peers. A few symptoms of cognitive disorder are aggressive behavior, destructive behavior, violation of rules, and deceitfulness. Therefore, if the student acts out here or there, 9 out of 10, they're just doing it for attention. However, if there's a consistency in the child's behavior, then the individual should be submitted for value evaluation. Another way to determine whether or not a child has cognitive disorder is to search that student's file for a family trend of diseases. Say for instance, the irrational behavior of a child comes out of nowhere, and a teacher is having a hard time to decide whether or not that student is just acting out for attention or is actually coming down with the disorder of cognitive disorder. The first step the teacher should take is to check the student's family history file for any traces of disease. If so, then more than likely that student is experiencing cognitive disorder and should be evaluated for the next step of help. Now, dealing with the classroom where maybe 1 or 2 students is diagnosed with cognitive disorder may be a difficult task for any educator to focus all the children on the content at hand. Therefore, when trying to implicate instructions in the classroom and dealing with cognitive disorder children, the teacher has to step outside of their box of their job duties of just being a teacher. The safest way to discover the problems that have started this outbreak of behavior is conversational therapy. So, if a teacher notices that a student is having problems, then perhaps during a lunch break or recess, that teacher should initiate a conversation with the child to try to uncover the problems that the child is having that is also causing this outbreak of behavior in the classroom. Now, many times, children do not always feel they can open up or feel comfortable to open up to adults. So, therefore, they may want to speak with someone who they don't have to see on a daily basis, such as a guidance counselor or a psychiatrist. So, maybe they can have separate meetings outside of classroom, maybe after school, before school, things of that nature. Now, if that does not work, then maybe the 3, which is the parent, the guidance counselor, and the teacher can collaborate on a plan to try to get this child to open up more and talk about their feelings, because cognitive disorder always drills down to one main factor of starting, whether that main factor is abuse, neglect, parent conversations, the way they talk to their child. Anyway, it all drills down to one thing. So the task of the teacher of trying to implement instructions is trying to take more one-on-one time with that student to find that one thing that started the cognitive disorder. However, the problem is the students don't always feel they can open up to anyone. So if the conversational therapy with the teacher doesn't work, or if the guidance counselor doesn't work, then they may want to seek outside help from a psychiatrist, something of that nature. Anything to avoid medication is best, because medication, the child does become dependent on it. So if those first 3 steps of the teacher conversational therapy, the guidance counselor conversational therapy, or the psychiatrist conversational therapy does not work, and the child is still acting out of class, then perhaps push comes to shove, it's not always good to separate a child from their peers. But if that child is taken away from the rest of their peers learning information in the class, then that child needs to be pulled out of that class and maybe given one-on-one teaching or one-on-one time, or maybe they just need time to talk about their feelings versus actually learning the content of school. It may hold them back a year or so from being up to speed with their grade level. However, whatever is needed to ensure that further on in their education, they are dealing with this conduct disorder that could possibly hold them back and possibly develop into ADHD or ADD or antisocial disease. So, if they have to be pulled out, then one-on-one time needs to be taken. Anything that needs to be taken to help this child develop, with conduct disorder from stopping it from going any further, because it can be stopped. It's just a matter of people taking time out and helping this child. Now, also with helping this child, it requires you to keep your promises, to not lie to them, because anything that they feel as though is not good for their safety or good for their well-being, they feel as though it's out to harm them, so they react on it violently. Whether it's somebody lying to them, saying they're going to come to their basketball game, anything, children take that kind of stuff to heart. So, when dealing with someone who is developing conduct disorder, or you realize is developing conduct disorder, it is very important to keep your promises, not lie to them. The littlest thing can really tick them off and send them into this rage and send them to just act so wild that you can't contain them. So, that's the first step. Those are the first steps in helping a child or advocating instructions for a child. It does take time. It is, time consuming, but us wanting to be educators, that's something we have to be faced with. We have to realize that that's a part of our job now. It's not just coming to class and teaching, or coming to class and showing them a problem and then leaving. No, you're actually a counselor, somebody can trust, someone can confide in, everything. So taking on this job really entails a lot. And by doing this research and doing this project, I feel as though we have all realized this as far as our future's career. So when dealing with conduct disorder or any other type of disease, it is very important to be as honest as possible with the children and be loyal and actually mean it with your whole heart, 100%. So to sum it up for you, conduct disorder is a behavioral disorder in children and adolescents. It is recognized by behavior that is considered unacceptable to society, such as aggressive behavior, deceitfulness, and violation of the rules. Oftentimes, conduct disorder is caused by family abuse. However, it can be credited to other things such as substance abuse and brain damage. Conduct disorder is usually the start of other diseases such as ADHD. Therefore, the earlier it is detected, the better. In a classroom setting, teachers usually have to step outside of their normal job duties and become counselors to try and help the students. Unfortunately, conversational therapy is not always beneficial, and further methods such as homeschooling may have to be taken.